when we look at the parasympathetic nervous system, because society unconsciously wants to put us in the sympathetic. So we have to be more mindful to turn on that. We have to take the time and go, I need a vacation.
Mm-hmm.
I need a rest. All those types of activities are getting us access and strengthening the parasympathetic nervous system so we can have balance. That's the big key. You can't stay in either one the whole time.
Welcome to the Individual Matters Podcast. I'm Andrew Caton, and today I'm very excited to share a fascinating conversation with Dr. Andrea Jordheim, upper cervical chiropractor and functional medicine practitioner at Transformation Wellness Center here in Grand Junction, Colorado. Having known Dr. Jordheim a long time and being aware of how much knowledge and expertise she has to share, I can't tell you how eager I was to get her on the show. In this episode, she describes the autonomic nervous system, which is responsible for regulating our body's unconscious processes. These include a phenomenon known as fight or flight response. If you're like me, you might have understood this to be a short-term reflex or temporary state of being. But did you know that it's possible to get stuck in fight or flight over long periods of time? When this happens, the negative effects on our quality of life, including learning and behavior, can become significant, resulting in a huge variety of symptoms that can mask as other problems. In the second half of the episode, Dr. Jordheim lays out several easy-to-follow exercises that you can practice today to strengthen your parasympathetic system, calm your mind and body, and improve your overall health. Hope you enjoy and get as much out of this conversation as I did.
Well, then let's just jump right into it.
Okay.
I think as a basic question for somebody starting off, how does someone's nervous system impact their health and their day-to-day functioning?
Sure. So the nervous system is the body's way of communicating with itself and with the environment and with others. And there is a controllable part of that, of the nervous system. Think, I want to run, so I need to move my legs. I want to, have a conversation with somebody, so I'm going to say this word. That is under pretty much our obvious and direct control. There's another part of the nervous system called the autonomic nervous system. And we want to think with that kind of like an automated part. So we do have access to this part of our nervous system, but the majority of what it does is controlling unconscious processes. So I don't have to think to myself, I need to remember to breathe, every couple seconds. I don't need to, think, I better be digesting that orange I just ate. Your body's going to do that naturally. And so that's kind of part of the autonomic nervous system. And that thing has two branches. So the first one is what we call the sympathetic nervous system. And people may have heard of that. We use words like the fight, or flight. It helps us meet a demand. The other part is the parasympathetic, and that is more of like a rest and digest, like the calming part of the nervous system. And both of them need to be able, to work together. So if we want to digest our food, we can't be running away from something. We need to be able to relax. And so that's part of the parasympathetic nervous system. And then the sympathetic nervous system is more used for focus. If there's an emergency, we want to turn that on. It's getting our body ready to fight, to run. Now, sometimes we just need to pause, but these two branches of the autonomic nervous system, think about left side of your body and the right side of your body. You don't want to just be operating in one side of your body all the time. You want to be able to utilize both and be able to flip back and forth to meet the current demand. And so if you're about to take a test, your kid's learning something, you probably want to be a little more in the sympathetic nervous system because you need to be very focused. You need to have all of your intent and your energy focused in that direction. But when that's over, you need to then be able to flip into the parasympathetics. And now you can integrate the thing that you learned. You can calm down. You don't need to be as on alert. And so both of these are very important. And having neuroadaptivity in the autonomic nervous system is a really key thing to health and wellness. Because if you don't have that from a day-to-day functioning standpoint, if you're, supposed to be hanging out with friends or you're enjoying a nice meal, but you're stuck in the sympathetic nervous system, and you're thinking to yourself, hey, I've got a work deadline. I have this test I need to do tomorrow. I have so much pressure from my peers and my parents to do this. You're not going to be able to relax and And over time, that's very wearing on the body. And so a lot of the chronic illnesses we see in America now are really driven by getting stuck in the sympathetic nervous system, that cortisol being up. And so having the ability to, one, some awareness to know, hey, am I stuck here? And then some tools to say, I really notice that, I'm spending a lot of time worrying and, I feel tense all the time. My muscles are always tight. Well, that's a sympathetic response. Absolutely. And we could talk a little bit more about what we see when people are stuck more in those sympathetics. But then having tools and ways to strengthen the parasympathetic calm. So generally, that's a long-winded answer to what the nervous system is and the unconscious, automated part of the nervous system. But having an understanding, sometimes it can, you can give yourself a break. But like, why am I so anxious all the time? Why am I so stressed out all the time? And realize it might be beyond your control a little bit. And your body's been programmed to be, to really run the sympathetic nervous system and is barred from getting and flipping to the parasympathetics. It doesn't matter how much intention you have to calm down and chill out. It's not going to happen. So hopefully that gives a little more understanding there for.
That sounds like a very clear explanation. You answered every question that was popping up in my mind as you were talking about that. So the autonomic nervous system is more unconscious. There's, it helps us, but there has to be balance between turning it on and turning it off.
Yeah.
And if it's on all the time, you're going to be exhausted and worn down and stressed, right?
Yeah, it's especially that part, the sympathetic. So it's always going to be on that automated system. We don't want to get stuck in one side or the other.
How does somebody get stuck in that? How does somebody, when they get stuck into a fight or flight type mode, how does that happen?
I mean, let's just take a simple thing. You're a kid, you're cramming for a test. So you're going to be in the sympathetics. And in this day and age, there's exam after exam. So one of the ways we get stuck is we just overrun that system. We're living a life that demands us to be there on a consistent basis. And, if we really want to flip into the parasympathetics, but you're not using it, so you're going to lose it, you strengthen the wolf you feed. And so if you're constantly in the sympathetics and not giving yourself an opportunity to calm down and be able to have a laugh, go out for friends, have a nice walk, sing a song. Those are all ways we can strengthen the parasympathetic nervous system. But yeah, generally we get stuck there because our demands require us to be there too frequently.
So our thoughts and our habits can get us stuck there?
Oh, absolutely.
Yeah. But there's also, we were just talking before I hit the record button, there's also structural causes.
Yeah. So structurally, one of the things I deal with a lot in the work that I do is there is an axis that we have. If we think about the nervous system, it's delicate. So we need protection for it. And one of the ways that we protect that is the body is built and we surround the nervous system with bony structures. So think about your spinal column. Its main job is to protect your nervous system. Yeah, it keeps you upright, allows you to move around, and there's a place for your muscles to attach. But really, if we're not protecting the neural tissue, the brainstem and the spinal cord and all of those nerves, then we're going to have potential damage in those areas. In the work that I do, I'm looking at the top two bones in the spinal column. They're freely movable bones, and they surround that neural tissue, and they're very near a part of the nervous system called the brainstem. Now, the brainstem, that is one of the big controlling areas of the automated or autonomic nervous system. And so if those top bones are not moving biomechanically correctly, maybe from a birth trauma, baby was born with forceps, they had a fall, there was some type of injury that was beyond the ability of the tissues to respond to and protect their position and their movement, then we're going to see some abnormal motion up in those bones. And now we've got a structural abnormality that is having a direct impact on the nervous system. So that's another way that, people people can get stuck in the sympathetics and not have access to that, to their left hand, the parasympathetics.
Can food or environmental toxins, can that cause this?
Absolutely, because anything that's a stressor. So that's
Okay.
a great example. So an environmental toxin, that is going to turn on the immune system. We don't want things in the body that don't belong there. So your immune system sees some cadmium, a heavy metal, or red dye, some artificial thing that the immune system doesn't like, or a virus or a bacteria. It's going to start recognizing a problem, and then the war begins. And a war is stressful, and we're going to turn on the sympathetic nervous system. Yeah.
You're an expert in this field, so you have different ways that you identify getting stuck in the sympathetic system.
Mm-hmm.
For people like me, are there any symptoms or signs, or what are the kinds of things, or how might this manifest in somebody's life?
Yeah, no, that's a great question. So people will notice things when they're, spending more of their time in that part of the nervous system. They might have digestive issues, sleep problems. Good one, they just feel ramped up for no reason. And we see a lot of anxiety, depression, worry. You're not able to relax. You're getting sick more often. We can see, slow wound healing. You've got lots of pain and inflammation. People will talk about, and this is a pretty noticeable thing, it just feels like, my neck and my shoulders are just so tense. Their muscles are so tight. That could be a sign that you're stuck in the sympathetic nervous system. You have changes in your appetite. You can even definitely having changes with managing or trouble, I'd say, managing behavior. So you have a child who is, there's no obvious explanation for why they're just breaking down all the time, or they're, aggressive, or they're moody. They're not in puberty. They're 7, and they are really having a hard time managing their behavior. And another thing that people will notice, and this is something you can notice in another person, is you might notice that they are staring a lot. They're not blinking. Well, there's a reason for that. And the reason is, if the sympathetic is about really ultimately at its core, it's to protect us from danger. So you need to be able to visually look at your environment, and that system needs to be turned on so that you can identify any of, coming threats. So you don't want to be closing your eyes constantly and just chilling out and relaxing. You want to be on alert, and you want your eyes open. And so you might have seen people yourself, sitting in a coffee shop, and this person's looking ahead and they haven't blinked in 5 minutes.
Do you see like pupil dilation? Is that?
Yeah, we can see that as well. Sometimes you could see some sweating and things like that. If we need to run from something, we want our blood flow to go to the muscles, to our arms and our legs, so we can escape. Yeah.
I think you mentioned when we were talking earlier about, is there a relationship to Alzheimer's or cognitive decline?
Yeah, absolutely. It's very hard to learn when you're in the sympathetics. And so there's been, recently in 2021 in the Journal of Alzheimer's Disease, there was studies showing that excessive sympathetic nervous system activation, so that getting stuck on, it leads to a much greater incidence in cognitive decline and definitely poor memory. Doesn't matter your age. And so, yeah, I think Alzheimer's is a huge issue, mild cognitive impairment, brain fog, focus. You have a child who is forgetting things all the time. Yeah.
So what you've just discussed, and I'm thinking we have a lot of parents that listen to this show. So I have to ask, how does, I think you called it sympathetic dominance, how does that impact learning?
Yeah. So sympathetic dominance is a fancy term that we use when the sympathetic nervous system is stuck on, it's dominating. So from a learning standpoint, if a child is stuck there, they've done quite a bit of research, and one of the studies done under the Journal of Clinical Child and Adolescent Psychology in 2013 found that children who are really stuck in sympathetic dominance have something I think we're going to discuss later, something called poor vagal tone. Now that vagal means it stands for the vagus nerve, and that's the other part of the autonomic nervous system, the parasympathetics. So that's that balancing part to the sympathetics. But when you have poor vagal tone, because you're in sympathetic dominance, they have a poor regulation of their emotions, their attention. They will have heightened emotional reactivity. They can't control themselves, like not, of course, a parent would want, but themselves as a kid. You're like, well, I don't know why I do this. I'm not sure what's going on. They can definitely, we can see peer-to-peer interactions becoming, think about, being bullied and things like that. That would be a way to turn on the sympathetic nervous system. And now that child is, unable to focus in school anymore. You see their grades start struggling. That can be absolutely a neurophysiological response to what we just think is something that all kids go through, and they just need to suck it up and stop behaving like they're behaving.
My thoughts go right to some of the parent questionnaires that are completed during evaluations, neurodevelopmental psychological evaluations, and these are like poor emotion and attentional regulation, heightened emotional reactivity, difficulty with inhibitory control. These are all symptoms of things. I'm thinking about ADHD. I'm thinking about executive functioning problems. You just see these sort of on one questionnaire after the next. So it sounds like there could be something related just to the nervous system that may be either causing or impacting or exacerbating problems with this.
Yeah, absolutely. Buzzword trauma. Trauma is something, but what does trauma really do? Trauma gets us stuck in the sympathetic nervous system. And whenever we're stuck there, there's a part of the brain. It's in the front, so just put your hand on your forehead. That part of the brain controls, higher functioning. And when we're having a trauma, or when we've had a trauma, and let's say the trauma's gone, and we're doing something like EMDR trauma therapy, but we're still not noticing, a real impact or a difference, it could be because the sympathetics is so over-engaged that you're not going to talk yourself out of that. We need to be able to access the parasympathetics and strengthen that, because when we're in sympathetic mode, we don't need to think about life's next great big question. We need to think, how am I going to get out of that? And that is a primal response. And so, we will definitely see a lot of these buzzwords and behaviors and that possibly being driven by an actual physical neurological thing.
That is so fascinating. You mentioned earlier vagal tone, and I wanted to come back to that. What is vagal tone, and how does that relate to what the other things you're talking about with stress?
Sure. So vagal tone is the word we need, or we kind of use sort of the opposite to sympathetic dominance. So vagal tone is one of the ways that we fight that dominance and help to balance it out. So in, getting back to the autonomic nervous system, the sympathetics we've just been speaking about is one side of that coin, and the other is the parasympathetic. The parasympathetics being the opposite of that, it is really focused on bringing the body back into balance and to a buzzword, another thing, homeostasis. So the ability to adapt from the sympathetic things we learned. So we were really focused. Now we need to integrate that. We need to bring that into long-term memory, working memory. That's why if we only say in the sympathetics, we have deficits in memory and cognitive function, because we need to integrate the things we learned. And so vagal tone I'd say it's one of the biggest neurological bundles that actually runs from the brain along the spinal column. And it's carrying the nerves that control the parasympathetic nervous system. And so strengthening that, or improving the vagal tone of the vagus nerve, which makes up the vast majority of the parasympathetic nervous system, is a way that we can begin to have the ability to adapt neurologically and balance out sympathetic dominance.
So stimulating the vagus nerve is a way to calm down after being in a stressful situation? Is that what you're saying, a way to get back to the parasympathetic and get out of being stuck?
Yeah, to get back to the balance again.
Okay.
Yeah, absolutely. So that's because it's an automated part of the nervous system. It's not as easy to access as, moving your big toe. But there are ways that we can strengthen that nerve bundle, the vagus nerve that makes up the parasympathetic nervous system, so that, let's say, we get done with a very demanding activity, we can have some tools that can allow us to get into the parasympathetics and start to recover and assimilate what we've had. And so there are multiple different things that we know can help with that.
I think you described already what the vagus nerve is and where it is, but maybe you can just give a real quick overview of that. When I think of the nervous system, I think back to biology class decades ago, and I think about the sort of the roots of the tree or the upside down tree. Where is the vagus nerve in the body? Can you share that again?
Yeah. So the majority of the vagus nerve and its nerve fibers run along the spinal cord. And so they're running along the spinal cord up into the brain. And so one of the ways, we can access that is if we do things that stimulate the nerves along those spinal levels, we can impact the vagus nerve. And also, that being said, there are things that you can do mentally from top down that can also stimulate that.
Okay, let's talk about some of that then.
Sure.
What are some examples of how do you go about stimulating the vagus nerve?
Mm-hmm. There are physical exercises people can do. There are psychological and emotional things that can stimulate the vagus nerve. And there are even devices that are utilized that can stimulate that. So probably maybe it's something we can do now, since this is an exciting conversation and I can feel my heart rate going up. Why don't we do something? It's called alternate nasal breathing. And so there's lots and lots of studies on this. The American Journal of Medical Science, they found that alternate nasal breathing is an effective way to, improve the vagal tone and decrease the sympathetic dominance that people might be in. Even in 2019, there was published a finding they did a randomized controlled trial, and they found that doing alternate nasal breathing for 10 minutes, 2 times a day, was an effective way to reduce blood pressure and heart rate. So if you think about, we don't really see that so much in children, but lots of adults have been diagnosed with hypertension. And so this is one of the tools that you can use that can help maybe before you even get on medication. The reason you maybe got there was you're in a high demand job and you're stuck in the sympathetics. So this is a very simple thing to do, and you can pretty much do it anywhere. It's very relaxing. You should notice immediately a difference. So how we do it, there's a lot of, I'm sure people have heard all about different forms of breathing techniques and exercises that you can use to kind of calm yourself down. This one's just very simple and very effective. So how you do it is you would take one finger and you're going to close one of your nostrils. And you want to take a deep breath in through the open nostril. And then you want to breathe out again through that same nostril that's not plugged. Then you're going to plug that nostril and then breathe in through the opposite nostril. So you'll breathe in and out on one side, plug it, then do the same one on the other. And you could do multiple cycles of that. And that is a very effective way to access the parasympathetic nervous system and the vagus nerve. So now you're strengthening that. And you're sort of, in a way, flipping yourself out of the sympathetics and getting your body to go, you know what? I probably would not be doing this if I was running from a lion.
Gotcha.
Yes.
Okay. Wow, that is so interesting. So you cover one nostril at a time and you inhale slowly.
Yeah.
And then exhale slowly.
Yeah.
And then you cover the other side, the other nostril, and you inhale slowly and then exhale slowly. And you do that for 10 minutes twice a day?
You don't need to do, well, you could, if you've got high blood pressure, you could do that.
Wow.
For some people starting off, I would encourage you maybe to build up, because you probably are going to be getting a lot more oxygen than you're used to, because when we're in the sympathetics, we pull in a lot of oxygen, but we also store a lot more carbon dioxide. That's why they say, hey, if you're stressed out, take a couple deep breaths. You're going to be getting quite a bit of oxygen with alternate nasal breathing. So maybe starting off with just maybe 5 or 10 cycles of that. In and out one side, then plug it, and then in and out the other side. But you can do it multiple times throughout the day, or just as it's all about getting a tool, right? So when we look at the parasympathetic nervous system, because society unconsciously wants to put us in the sympathetic. So we have to be more mindful to turn on that. We have to take the time and go, I need a vacation. I need a rest. All those types of activities are getting us access and strengthening the parasympathetic nervous system so we can have balance. That's the big key. You can't stay in either one the whole time.
That totally makes sense. This is so fascinating. I'm going to try that. I know that anybody who's listening to this is probably thinking the same thing. Like, wow, this is such a simple tool to give a try to see if this kind of brings things down. Like you said, that is, you have a bunch of different exercises. Do you want to go into some of these other ones that,
sure,
that
maybe
folks can try?
we can hit on a couple. I think they're kind of fun and fitting. I'm sure everybody's heard laughter is healing. The truth is it is. Laughing is one way that we can stimulate the parasympathetic nervous system and the vagus nerve. Doing things like even humming, so with your lips pursed, or saying singing, so humming, singing, some of these rhythmic type things, gargling. These are all things that can help us, to do that. So gargling, a good example, you could make this part of a kid's practice because it's really easy. In the morning and evening when they're brushing their teeth, have them, brush their teeth, spit out, get some water, and gargle that water for, 30 seconds to a minute, and spit that out. That is a way that we're now actively, physically stimulating the vagus nerve and strengthening the parasympathetic nervous system. Things like cold exposure, those are exercising. Really, when it comes to physical activities, all the things they've told us to do, like exercise, challenge the body in a positive way, these are things that, they're healing. That's why exercise is a healing thing for people, for kids. Doing things like giving yourself a butterfly hug. So the butterfly hug is you're really wrapping, obviously, it might be better just to hug somebody you love. But if you're alone, you just wrap your arms around your body, placing each hand on, opposite shoulder, like you're going to pat somebody on the shoulder, and then just really hugging yourself and, till you're calm. Weighted blankets. Why do weighted blankets help people calm down? Why do we use that in the autistic spectrum world? For people who have, hyperarousal, they maybe have auditory and, visual processing issues. The weighted blanket, that pressure on the system, that's why it feels good when a dog comes and lays on you, that is stimulating the parasympathetic nervous system. That is telling the body, you know what, everything's okay. We're going to make it. It's fine. You can calm down.
This is so interesting. Do you find that kids tend to seek this out naturally? Does it get more difficult to come back to this as you get older, or is it just across the lifespan? You just have to actively...
I think it's going to be, sorry to interrupt there, I think it's going to be kind of normal to see a kid giving themselves a butterfly hug. It's going to be a little weird if a 40-year-old man standing in the middle of the grocery store doing the same. It's all about kids are open, right? They are going to model the behaviors they see around them. And so as a parent, voicing, hey, I feel stuck here. I feel overwhelmed, ramped up. I'm feeling sad today. And then doing some of these activities, psychologically, things like meditation and gratitude journaling, exposure. Why do we like looking at a beautiful sunset? These things stimulate the parasympathetic nervous system. So modeling these behaviors to your children and those around you make it more, I think a good example is when a woman's pregnant, all of a sudden she notices all the pregnant women around her in her life. And it can be the same thing with this. The more we see it, the more we're like, oh, that's a normal thing to do. Oh yeah, I am going to join a choir. Oh, I'm going to, hum to myself. Rocking back and forth. That is a soothing behavior because it's stimulating the parasympathetic nervous system.
So the more you do this, the more momentum you're building as well.
Yeah, the more access you have to go, okay, you'll find your body, because this is an automated autonomic nervous system. So if you've strengthened the parasympathetics, you can have a very sympathetic dominant experience. And then without, because you've practiced, you're able to then unconsciously, your body will know, hey, that's over. And it'll start to self on its own without so much of your active, intention and drive, do things that make it feel good. That's why once you've had kids and you're, let's say you're standing at the grocery store, mom might be in their 50s, their babies are long gone and grown up. And if it's a stressful situation, they've been waiting for a long time, what do they start doing? Just rocking back and forth just a little bit. Yeah, it's all that.
That is so interesting. These exercises, some of them people might find easier than others. Like I'm looking at exercise, and for some people lifting heavy weights is easier, more downstream than for others. But you have other things on here that are really like taking cold showers or finishing with a hot shower with 30 seconds of cold water or vice versa. Just going outside in cold temperatures with minimal clothing until you feel cold. Just little easy things
just
like
very simple thing. I mean, that's why when people are stressed out, they splash some cold water on their face. So some people will find they don't want to get in a shower necessarily because it's cold, but you could get a Ziploc bag or just a washcloth and put some ice in it and then just holding that against your face for 15 to 30 seconds. Definitely taking a shower, doing a quick little cold shower for 30 seconds and then, turning that off. If we think some of the European countries, this is very interesting with their children. And I mean, we have a great healthcare system here in America, granted a bit expensive. But in European countries, they'll take things and take their babies out and they'll leave them out in their strollers in the middle of winter, bundled up to get that cold air. And they'll go and have, a nice lunch with their friend. Both of those scenarios, you're strengthening the parasympathetic. You're engaging in a social activity with your friends. You're probably laughing and having a great time. The baby's out there sleeping. They're getting that cold exposure. That's strengthening their immune tone and the parasympathetic nervous system. So they're less likely to get a cold or to get sick. And so look at the practices we've done around the world. We know the why, but sometimes it doesn't make sense. Okay, well, how is that really impacting something like our ability to be adaptive to life and to stress?
Yeah, not to go off on a tangent, but I think about thermostats and how we control them within these, couple degrees of this comfort zone. But that sounds, it's almost conditioning. It's very different than going outside and being cold or jumping in an ice bath or shocking your system with different. And so we just get used to it. And then anything outside of that range becomes really uncomfortable.
Oh, yeah. We like comfort, don't we?
All right. This is all really good stuff. And I'm going to post this in the show notes so that, if that's okay, so that people can find this. And I'll put some other information in there as well. I know this is such an interesting conversation. I know I've known you for a while, and I know you could talk about other stuff related to this too. We're just getting warmed up, but just in the matter of time, is there anything else that you wanted to cover today related to the vagus nerve, how to stimulate it? Are there any other programs or exercises or devices or research that you want to share?
Sure. Well, I think probably some people might find it a little difficult to have to remind themselves to gargle and hum, and they don't want to do cold exposure that day. They maybe hate doing a gratitude journal. That's not up their alley. Or they have a young kid who it's almost going to create more of a stress to pressure them to do parasympathetic vagus nerve stimulation. And so that's a problem. We can use devices, and there are a lot of professional and consumer grade vagus nerve stimulation devices on the market. The one that I use often in my practice is something called a transauricular vagus nerve stimulator. And these are external devices. Now, there are some that are used in the medical community as an implant. They've been used and were first really implemented in the world of seizure control and seizure disorders. But we can use ones that are outside of that. Transauricular just means through the ear. And they are set so that you can turn them on for, I'd say average is maybe 15 to 20 minutes once or twice a day, and go about doing, normal activities, but be actively strengthening that vagal tone, the vagus nerve, and the parasympathetic nervous system. And that can really be a passive way to improve multiple areas of your health. So we know that it affects your gut health, mood, children who have a lot of issues with constipation. That can be a sign that they're stuck in sympathetic dominance. And sleep, energy. So we can utilize these devices for multitudes of reasons. Blood pressure, of course. There's a great company called Nuvana, and they have a device called the Zen device. It's a little handheld device that Bluetooths to an Android or an iPhone. And the nice thing about it is the vagus nerve stimulator is a headphone. And so one side, the left side, is the vagus nerve stimulator. It's just a little pulsing depending on the frequency we're using. So that's a deeper discussion, but they have consumer guide stuff for that so that you can find something that works for you or for your child. Nice thing is the other side, the right side, is actually just a headphone. So you could be having, listening to a podcast. You could be listening to music. You could be even watching a cartoon and be utilizing the vagus nerve stimulator at the same time. You could be doing the dishes, walking around the house, doing laundry. So these are great devices. And if people are interested in them, you're more than welcome. I very much like this company, and I know that a lot of our patients really enjoy using it. Their website is Nuvana, Nuvana life.com. And if you put the code TRANSFORM, TRANSFORM, you can get a discount on that device, and you'll get all sorts of guides and tools from that company. They're a wonderful company who has done research utilizing their device in multiple fields, which is huge. You want to make sure that a product you're using actually does what it says it's going to do.
Absolutely. That's great information. I'll put that in the show notes as well. This is the most fascinating conversation I've had in a long time. Is there anything else you want to share today related to the vagus nerve and the autonomic nervous system?
I'd say the one piece maybe that ties into a lot of the work that I do, I see a lot of adults and children who are having issues, no matter what therapies they've been doing. Maybe they've been trying and they're familiar with the vagus nerve, and they've been told they need to meditate, but they just can't ever get there. Or they have been told they should be journaling, or they've been taking their child and doing all sorts of different therapies that should be helping them, achieve their success in life and school, and they're still not noticing a huge difference. And so it's not just about strengthening the vagus nerve, the parasympathetics. It's really about the ability for the body to be able to access both sides and to be able to flip. And so when I work with individuals who have, we call it movement or biomechanical dysfunction in the top two bones in their neck that surround the brainstem and the spinal cord, where we house the autonomic nervous system and these two parts. If there is an issue going on in that area, and for the majority of the time, most people don't have issues with that. But if somebody does, we want to kind of retrain that motion in a very gentle and specific way, just to get the person back to having access again. And so if that is not addressed, then you're not going to see as much benefit from this. Because if your right arm and leg are, actively moving around, your left arm and leg are tied down, doesn't matter how much effort you put in trying to move that side, you can't get at it. And so I work with people who have issues in that area, so that when they do utilize different therapies, when they are doing things to strengthen the parasympathetic nervous system, they can do so effectively. And ultimately, my goal is to get them to not to need to come and see me. That we want them to have, you go to the dentist to get your teeth cleaned. You don't want them filling a cavity if you don't have one. So we really just want to get a person back to how their body was designed to, adapt and move and function so you can be successful out in life.
I said at the beginning of the episode, you're an upper cervical specialist and you're certified functional medicine practitioner, and you work with issues with the immune system, hormones, cognition, gut, and other systemic effects. You have a passion for nutrition and healthy eating. I promised I wouldn't get too personal on this episode, but I know firsthand the quality of work that you do for your clients. I just couldn't recommend you strongly enough. If somebody's looking at or struggling with any of these kinds of issues, you really take a holistic approach. You have a phenomenal background and expertise around that. And it seems to me that these are issues that may not be looked at very commonly in our everyday normal, the way that we go about practicing health and medicine and so forth. So you provide some answers that I think may be hard to find if somebody's not working with somebody like you. So I can't emphasize how glad I am that you came on today to talk about this. For folks in Western Colorado who are interested in learning more about your services, maybe want to set up an appointment, or and I know you're busy, but how do they find you?
Sure. You're welcome to give the office a call. It's 970-812-5559, or probably even just going on our website at mytransformationwellness.com. I always offer free 15-minute consultations for both functional medicine and upper cervical care to see if I'm a good fit for you. And likewise, or if you, even from the upper cervical care standpoint, if you're even a candidate for that care. So you are more than welcome to do a in-person. I prefer that for the upper cervical. But for functional medicine, we can do that virtually and chat a little bit more and see if I might be able to help you along your healing journey.
That sounds great. Thank you so much for coming on. You're like an encyclopedia of knowledge around this, and we just touched on one aspect of what you do. But if you ever want to come back on and talk about more stuff, we've had conversations before. I know how many different issues you can talk about and that you're knowledgeable about. So hopefully we can get you back on sometime.
No, I appreciate it.
All right. Thanks a lot.
All right. Take care.
To learn more about Dr. Andrea Jordheim and the services she offers through her practice, visit mytransformationwellness.com or call 970-812-5559. I put this information in the show notes as well. And like I said at the start of the episode, Dr. Jordheim's expertise is both wide and deep. Areas of specialty include hormone imbalance, oxidative stress, mold illness, detox, gut health, chronic inflammation, immune dysfunction, and other complex and chronic health conditions. If you're looking for a holistic approach to restoring your health and well-being, check out Dr. Jordheim and Transformation Wellness Center. That's it from us today. As always, you can find more information as well as resources on our website, individualmatters.org. We hope you'll join us at the next podcast, where we'll continue to explore topics around successful living, learning and education, and child development, and share ways to help you live a more positive and fulfilling life.
The preceding information is not intended to provide or serve as medical, clinical, or educational advice. Individual Matters is not responsible for the accuracy of guest statements. All information should be validated independently. Please consult with your doctor, mental health provider, attorney, or other appropriate professionals before making any personal decisions for yourself or those in your care.